Our next panel will talk about really what's going on right now and some of the investments that are being made right now, either through the Partnership for Food Protection or from FDA with the states. And again, it was the Partnership for Food Protection, which is funded by FDA, that is designed to engineer the development of the strategy to develop a fully integrated food safety system. Our panel today consists of prominent members of this Partnership for Food Protection, representing FDA, state, and local government. The first speaker will be Dr. Steve Solomon. Steve was appointed the Deputy Associate Commissioner for Regulatory Affairs within the Food and Drug Administration's Office of Regulatory Affairs in April of 2014. Prior to this appointment, Steve served as the Associate Director for Global Operations and Policy in the Office of Global Regulatory Operations and Policy, where he provided leadership on issues relating to trade, global public health policy, global supply chain, and specific issues related to China, India, and the G8. He's also served FDA as their Deputy Associate Commissioner for Compliance Policy and ORA, and he's worked for the Center for Veterinary Medicine and in their Office of Enforcement and Office of Regional Operations. Next will be Pat Kennelly. Pat is the current Chief of the Food Safety Section of the California Department of Public Health. He currently serves on the Governing Council, the Partnership for Food Protection, and is a member of FDA's FSMA operations team representing states relative to the new produce safety rule. And then Adam London will talk. Adam is the Administrative Health Officer with the Kent County Health Department in Grand Rapids, Michigan. He's a registered sanitarian, and he's a member of the Governing Council for Partnership for Food Protection. He has a burden today of representing the approximate 3,000 or so local health agencies in the United States, who are really a critical part of this integration effort. Dr. Solomon?
Well, I think I can still get in a good morning, so good morning, everybody. I was hoping to welcome you to my hometown of Baltimore, but I'm not so proud of the city right now, and I do hope that the situation, the unrest gets resolved, and that the people that have been injured will recover and there's no further injuries. But it's a tough time for the city right now. But I am delighted to be here to talk to you about the investments in an integrated food safety system, and I particularly want to thank AFTA, and I want to thank Joe for his years of vision and commitment to try and produce this, because none of this would have happened without him. One of the things you've heard, and there's going to be a little bit of repetition, I think, in some of our discussions here, but one of the investments is in collaborative relationships that we have with our strategic, regulatory, and public health partners. So it's a big phrase, but there's some important words in there, and it's collaborative relationships. If you haven't sort of picked up on it, the people that have spoken today, we all have worked together for many, many years. And we've gotten to know each other. And we get to know the strengths and the weaknesses and how to work together. And despite Travis's comments that, I would go shoot him, his comments were right on target because it's built on trust and relationships. There's an old adage that you don't want to be meeting your regulatory partner or your public health partner during an emergency. The folks here, if you haven't picked up on it, have the ability to pick up the phone or email each other or talk to each other and start talking about an issue early on. Building those relationships is an integral part of an integrated food safety system. And it's a lot about relationships, and it's a lot about culture. And, Joe started us off this morning with the toothbrush analogy. The culture has changed tremendously over the years. I've had the opportunity to spend 25 years looking at this. And while I've seen FDA and other federal agencies, state, locals, and territorials have a great history of working independently to improve food safety, you've heard today that it's become increasingly apparent that no one agency, neither FDA nor the state or local agencies, can protect public health alone. We need each other. Only through our collaborative efforts and relationships with each other can we form the food safety net that's needed to protect consumers. What drives this, and what I get very proud of, is the unification on public health. Everyone that's working on these integrated food safety systems is driven by the same public health vision. And it's our strength that ties us together to try and solve these problems. So you heard Mark say, this is what gives me a warm fuzzy at night. You hear others, Ernie talking about, with his passion about, how we looked at this issue and how we solved those issues. It's a great unifying force, and it's the great strength behind an integrated food safety system. So I want to spend some time talking a little bit about the investments, because none of this would be possible in building relationships without some of these. So you've heard a couple numbers, and I'm going to throw some additional numbers at you. Since 2009, FDA significantly increased its investment in state and local regulatory public health agencies. Back in 2009, we were able to invest $25 million a year in funds to support the various initiatives. You heard from Jeff this morning that in 2014, we were spending over $60 million. And in FY15, we have the ability to significantly increase that funding to an even greater degree. In total, from 2009 to 2014, the Office of Regulatory Affairs has invested over $230 million into a number of activities that you've heard about this morning, and I'm quickly going to go over some of those investments. So you heard from Steve this morning about the Manufactured Food Regulatory Program standards. We've invested $30.1 million in that investment between 2009 and 2014. In FY14, last fiscal year, or the current fiscal year, $9.7 million in those 40 programs that Steve talked about earlier. This represents 89% of the food contract work that FDA has currently done. So Steve talked about the type of states and the programs that are involved in it, where most of the manufactured food work is done. Steve also talked about the ability to create this alliance. So there was great vision that was behind thinking about this. Not only did we create these manufactured food regulatory program standards, and Steve talked you through those standards, they're the foundation of what a high-quality program looks like. And he walked you through those 10 elements. But we recognize that standards don't stay static. So we've created this alliance, and as was mentioned earlier today, we're now getting revisions to those standards to keep up. Foodborne illness, the pathogens you've heard today people talking about, don't remain static, and the standards shouldn't remain static either. So we've got a process for trying to update and revise and continuously improve those standards. Essentially, what are those standards? They're a quality assurance program about how this regulatory program works. The impact of MIFRIPs is tremendous. You're going to hear some more later this afternoon, but the Food Safety Modernization Act is going to have dramatic changes on these standards as well as how we do business. So obviously you're all familiar, you heard from Mike Taylor about preventive controls that are going to be in place, but that means the standards are going to have to change, which means states may need to look at how they're going to adopt the new changes in the Food Safety Modernization Act when the regulations come out. And there's not one size fits all. The standards are going to be changing over time, but the states that have been enrolled in the manufactured food program have a distinct advantage because they've been thinking how to better assimilate this information over time than the states that have not been enrolled. They've got the systems in place that it's going to make it easier to adopt. Just a couple of the changes, just to reiterate, that the Food Safety Modernization Act is going to have on the manufactured food standards. Obviously, Standard 1, which is the regulatory foundation, the rules are going to change. Some states have the ability to adopt by reference, which means when the FDA makes changes in the Food, Drug, and Cosmetic Act, they can automatically adopt it. Some of them are going to have to do an evaluation and do it adopt by reference. Some are going to have to pursue rulemaking. It's no easier to pursue rulemaking in a state than it is in the federal Congress. So there's challenges there. Training has already been highlighted multiple times. Significant new training of regulatory and public health partners is going to have to take place along with FDA. And looking at new training resources I'm going to talk about, the Institute for Food Protection and Training that we talked about is going to be a significant changes. How we do inspections is going to change. Allergen controls is a new part of FSMA. Preventive controls, new part of FSMA. How we do inspections is going to change over time and going to have new changes to the MIFRP standards. You've heard a lot about the food-related illnesses and outbreaks, and by having the rapid response teams that Travis talked about, through having a partnership for food protection best practices, it's going to make it easier for folks to adopt to these changes. And I'll talk a little bit more about the laboratory support pieces. As mentioned, FDA has asked the MIFRP Alliance to take on the challenge of thinking about how to change the MIFRP standards to better align with the Food Safety Modernization Act. They've agreed to take a look at that, and they're going to be working on it, but they've just successfully made the modifications to the standards for the first time. We're also making investments in other associations, communications tools, partnership funds, funded workshops, and other collaborative activities. You've heard people sort of mention these today. The importance of those is it helps build those relationships. Sometimes these are relatively small amounts of money, but they're funding that allows people to get together and be able to talk about the problems and how to address those problems. Travis did a great job talking about rapid response teams this morning. We've invested $33.6 million between 2009 and 2014. He talked about the 18 states and the 14 district offices. This has been, as Travis mentioned, a very successful investment. As of a few months ago, the teams have investigated 148 incidents, conducted 42 tracebacks, which many of them went back to the successful identification of the source, and you saw some of those examples, and followed up on a wide variety of recalls and complaints. But one of the other benefits of the rapid response teams is I had an opportunity to go to this year's meeting, and the rapid response teams were sitting there with all the variety of disciplines that Mark mentioned about and others that need to be part of an outbreak response. And they were sitting around tables and talking about how would we address this. And we were doing an exercise to think about how the response would work. If you think back years ago, many of these people had never talked to each other, even though they're within the same state. So I want to reinforce Mark's point about integration is just not a federal state. It's states talking to each other. It's within a state. One of the investments that hasn't been talked about is Food Protection Task Force grants. We currently have 16 grantees. And these are an example of just a relatively small amount of money that have a big payback because it gives opportunities for people to meet within a state. It's building a larger community of food protection stakeholders by these task force interactions. I've watched some of these task force and noted their accomplishments, and it could serve as a model for local integration of activities. And Joe teed up this morning the question of, well, who's part of an integrated food safety system? And Joe was right. We have not had the opportunity to engage consumers and industry to the extent we have. But one of the advantages of these food protection task forces is that it has diverse membership. So task force memberships can include, besides FDA, members of academia who are represented here, law enforcement, local health departments, state regulatory health officials, and industry. There's no prescription on how these task forces can be run and who can be part of them. So that helps that all these people are better able to respond quickly, and they're building the relationships, which is an underlying piece of the integrated food safety system. We haven't talked a great deal about it, but we're following a new model for the animal feed regulatory program standards. We're following a lot of the model created under the manufactured food programs. These are new standards, but they were developing by FDA and the state feed programs together in developing these standards. These are a new entity, and it's going to take time for them to become fully integrated and develop what needs to be done. They're going to have significant challenges because as preventive controls for animal feeds are rolling out, not only are we looking at GMP controls, good manufacturing practices, but we're also looking at preventive controls. So we're looking to have significant investments over the next number of years, and sustainability is important. 80% of the animal feed work is done by our state counterparts. You've heard mentioned, and Adam will talk some more about it, the voluntary retail food programs. It's been an investment of $10 million. Supports 631 regulatory jurisdictions. Let's not forget that outbreaks start locally, and having that key of the locals there is important. We've mentioned several times the laboratory science issues and accreditation. $88 million has been invested between 2009 and 2014. They're supporting 30 laboratories reaching ISO 17025 accreditation. You also heard this morning about the APHL grant from Ron. And once again, we're very appreciative of that. APHL is working in collaboration with AFTO and AFCO, the American Association of Feed Control Officials. Once again, another example of integration that years ago you would not have seen three associations working together under one agreement to try and multiply their impact. We also maintain and enhance our response to foodborne emergency response in our laboratories. The FERN network has microbiology, chemical, and radiological. It's a $10 million investment. The total FERN investment since 2008 has been $66.8 million. We currently have 34 state laboratories that are part of that network that are doing both emergency work and routine work on a daily basis. We have 15 microbiology labs, 14 chemistry labs, and 5 radiological labs. And not mentioned here is since 1973, FDA has been funding contract inspection work. We've invested $82 million from 2009 to 2014. The bulk of the feed inspection work you've heard several times today. In the current year, over 11,000 food inspections, over 4,300 feed inspections. We're investing $16 million this year. We have 45 states that have food contracts with us, 32 states that have feed contracts, 17 tissue residue, and 7 states have aid contracts. But it's not always just about investment of money. Money helps, but there's other investments. Training. Many of the folks have been participated in our ORA University, on our online web courses, and we've come to the realization by sitting side by side in courses and learning the same material at the same time furthers that building of relationships. We've also put down training cooperative agreements with International Food Protection Training Institute, National Environmental Health Association, Auburn University, University of California, North Carolina University, and the University of Tennessee, totaling $7 billion. We need the expertise of academia to bring the best science forward. It was mentioned before, but it's worth mentioning again, the development of a new position that started in 2010 in FDA of the state liaisons. Once again, we invested in developing people whose job is to help further integration between FDA district offices and with states. The state liaisons provide a direct interface between FDA and the states for day-to-day operations. They answer technical questions, they help do coordinated work planning, and they assist with coordination of outbreak emergency response along with the regional and the district emergency response coordinators. And older programs, but we shouldn't forget about them, are our cooperative programs. Federal state cooperative programs have existed for a long period of time. There's 3 separate food safety programs: the Milk Safety Program, the National Shellfish Sanitation Program, and the Retail Food Protection Program. We have 59 cooperative program specialists on board. They assist states and local programs through the cooperative programs by providing guidance, training, certification, and other technical assistance. These programs, while old, are often cited as the examples of integrated food safety system. So let's talk a little bit about the future. Mike Taylor mentioned before that we've submitted a budget request to Congress for 2016 for an investment of $32 million that we specifically want invested in an integrated food safety system. What that request consists of is FDA's plans include enhancing the training and collaboration needed with the states and other government counterparts, working with state representatives and other regulatory partners to develop and deliver the FSMA training curriculum that we were talking about earlier to facilitate the consistent application of the new inspection approaches. We need to continue to build the operational relationships and the infrastructure for a national integrated food safety system. I think it was mentioned earlier that when this idea first came about, the 1998 meeting, there was not the type of infrastructure there. We need to build the infrastructure and invest in it so that it's sustainable over a long period of time. Enhanced information and data sharing, we're in a whole different area. Right now, with the internet and the movement of products, the information flows so quickly that we have to get more robust and have real-time information sharing. And we need to make sure that all our regulatory and public health partners have access to the same information at the same time. We need to continue to develop new inspection grants, cooperative agreements, contracts to reflect the changes that the Food Safety Modernization Act is going to have on us. And continue to enhance the process of joint work planning to ensure coordination of inspection strategies and plans, consistency of regulatory approaches, and optimal risk-based use of FDA, state, local, and territorial resources. And we want to continue to invest in our lab accreditation areas. We've given a lot of thought to being able to sustain the integrated food safety system. And this is important. State budgets, local budgets go up and down. Federal budgets go up and down. We need to make sure that we're all invested and all contributing to try and have sustainable models that are going to move us forward to have a system that is going to continue to grow. There's not going to be some magic moment when we say, eureka, we have an integrated food safety system. It is going to be an iterative process. It is going to develop. We've made tremendous progress, but it needs to continue. So we're looking at new funding models, tiered funding models. Not every state is created equal. Rhode Island is not the same as California. The funding models may need to reflect certain criteria, and we need to work with our partners to try and figure out what those criteria are. Are they based on population, at-risk population, number of facilities, number of high-risk facilities? We need to figure out how to have the appropriate funding and the right measures to ensure the funding is used appropriately. We have to have multiple funding models because not one system works for every state. Each state and even programs within states have very different ability to use the funding, and we need to have the greatest flexibility to allow our partners to be able to get the money that's going to be invested directly in what best protects consumers. And we're thinking about the next steps. So now that we're building these manufactured food regulatory program standards, animal feeds, we're saying, well, the next step is how do we develop a program of mutual reliance? So we're developing some pilots with a couple of the states that are reaching that 100% conformance with the manufactured food program standards. So over the next 12 to 18 months, we're going to be working with some of our partners to test out what mutual reliance really means in furthering an integrated food safety system. And it may not look the same in every state because you've already heard from the different states about their industries different. Steve Stitch talked about their imports. Others have been talked about their manufactured foods. There may not be one model. And then there's an important aspect of this large an investment, and that's oversight. So there is oversight over the process, which I believe is a good thing. So the Government Accountability Office, GAO, was asked by the Senate Health, Education, Labor, and Pensions to do a study of an integrated food safety system. They had an entrance conference in March of this year. Have had several meetings with folks, and they're asking a couple broad questions. To what extent has FDA demonstrated progress in integrating federal, state, and local food safety oversight? What challenges, if any, does FDA face in integrating food safety oversight? What options exist to address any identified challenges, including activities of other federal agencies or foreign governments that might apply to food safety? If GAO reaches out to folks, I ask folks to share information with them, tell them your experiences, and we hope to have a report that's going to help further strengthen an integrated food safety system. But that's not the only oversight we've asked about. FDA has a science board. That's an independent group that looks at science within FDA. And as I mentioned before, we've asked them about our investment in the Food Emergency Response Network. So we asked them to form a subcommittee to do a complete review of this investment, with a goal being to ascertain how we can advance and establish an effective integrated laboratory network among FDA and the state public health and food and feed testing programs. So what's the bottom line is these investments is our goal and vision, which you've heard several times, is to create a seamless partnership and operation among federal, state, and local agencies. They're our strategic partners. We want to protect public health. We want to achieve a safer food supply, and we all are committed and dedicated to that effort. So we deeply want to make this a reality, and tremendous progress has been made to date. One of the vehicles that you've heard about, and you're going to hear some more about, is the Partnership for Food Protection that we finally abbreviate as the PFP. You heard about when this was established after the 50-state meeting in 2009. You'll hear some more about who it's made up of. Their role is to promote communications and integration between all the different jurisdictions. And you've heard examples of how that is working and succeeding to date. So some of the aspects of work that the partners are doing, they're planning and prioritizing work to coordinate resources, implementing and using data from foodborne illness and outbreak surveillance for evidence-based food safety policies and programs and trying to evaluate their effectiveness, implement efficient, prevention-focused, and risk-based inspection and sampling strategies, sharing data, not toothbrushes, among strategic partners, and promoting use of compliance and enforcement tools. So the PFP is not a policy-setting body, but it is one of the major vehicles in the development and implementation of an integrated food safety system. I'm going to turn it over to my fellow members of the PFP Governing Council to give you more information about it.
Thank you, Steve, and good morning, everyone. My name is Adam London, and I'm the director of the Kent County Health Department in Grand Rapids, Michigan, which is, of course, a local health department. And quick show of hands, are there any other local public health officials in the room? All right, a few of you. So I don't share the burden of representing what we do by myself this morning. As Joe mentioned, there are over 3,000 local public health agencies across the country, and by population, we are the largest component of the public health workforce. So what we do is critically important that we're integrated into the work that's happening at the federal and the state levels. And I also want to appreciate the presentation that Mark Reed gave in the earlier panel. That case study was fantastic. And the demonstration of how the state and locals work together was amazing. I think I counted 20 times where local health departments were mentioned, and I stopped counting them because a tear was coming out of my eye. So it was much appreciated. Thank you for that. So about a decade ago, there was an expose on one of our local television stations in West Michigan where they had FOIA'd some papers, they had talked to some people on the street, and did a presentation showing how poor the food safety was, or how infrequent the inspections were at a couple of our small local grocery stores. I know I have Corey and Scott here from the Meyer Food Store Corporation, and it wasn't you guys. You guys do fantastic work, but this was a couple of small operations. The next morning, my boss wanted to talk to me And when we had the conversation, her question was, so what's going on? Why aren't we inspecting these places as often as we should? My response was, well, in Michigan, at the local county level, we don't do the routine inspections of the grocery stores. That's handled at the Department of Agriculture. But I'm happy to give them a phone call this morning and find out what's happening there. So that's good. You do that, and I've got another assignment for you. This morning I had over 20 voicemails from people wanting to know what's going on. So here's a list. You can call them after you call your friends at the MDA. So I spoke with a colleague at the Department of Agriculture, and the story that they gave me was, of course, much more complex and much more complicated than what was presented on television. And there was a corrective action plan and a game plan for handling what was happening at these limited grocery store examples. I then started on the list of people who had called, citizens who had called, commissioners who had called, wanting to know what was happening. And the very first person on that list, I'll never forget her. I called her, sweet elderly woman, a grandmother. I explained to her what was happening. And when I was done, she said, well, honey, thank you. However, it really doesn't matter to me. I really don't care who is doing what and what agency is doing this or that. I expect you government folks to work together to protect my grandkids from that E. coli. So, point taken. And I think it's that sensibility that has driven what we're trying to accomplish with this partnership in creating an integrated food safety system. So PFP, as has been discussed earlier today, has been around for quite some time, but it was just in 2012 that we recognized that we needed to advance beyond a coordinating council and actually form a governance council with a formal decision-making process for reviewing documents and guiding the work of our cross-disciplinary work groups across the country. Some of our responsibilities include being responsible for the overall leadership, management, and direction of the PFP, identifying strategic areas that further the development of an integrated food safety system, and this is really a dynamic process. We meet over the phone on a monthly basis, and we have work group meetings that are ongoing as well, where we're constantly looking for gaps and needs and trying to fill them responsibly. Establishing those work groups as we see the needs, and providing support and guidance for them. And finally, developing reports that we can share throughout our federal, state, and local partnerships and throughout the associations that represent us as food safety professionals. There are 13 members on our governing council, 6 of which are non-federal representatives, and you can see the names here on the screen. They represent a variety of different disciplines, from veterinary science to laboratory to local and state. We also have a couple of at-large members. And then there are our federal members, 5 of which come from FDA, and those are from the executive level at different centers within FDA. We have a member from the USDA and a member from the CDC. So altogether, there are 13 of us. We're all government regulators representing a broad span of professional expertise. I want to talk a little bit about some of the successes that we have had so far. I'm not going to spend a whole lot of time on them, however, because I think you've heard an awful lot already this morning about some of these successes. What I do want to say to preface this is that I think the greatest success of the PFP is the fact that it exists at all. To have this sort of a partnership where locals and state and FDA leadership are all in the same room talking about these issues and finding opportunities where we can leverage what we do for better outcomes has been really powerful. When I speak to my older colleagues who have been in this profession for a while, they're astounded that this is happening now, that finally, I think Jeff mentioned this morning, that integration has been talked about since 1938. However, we're finally, in the past 10 or 15 years, doing something to make it happen. One of those objective outcomes has been the National Performance Standards Crosswalk Resource Paper. The standards, the regulatory program standards, have been discussed a number of times this morning. There are four at least here that we have reviewed for that consistency. And as Steve mentioned this morning, they're very similar, and that's intentional now. These are the standards which guide regulators on how to perform our discipline, how we train, how we communicate, how we develop work plans, how we deliver what we do. And now by having some standardization between the different focus areas of voluntary standards, now it doesn't seem so disjointed to all of you. The model for routine work planning coordination. So in October of 2013, this document, which we call the work planning document, was released, which provides guidance, a best practice for how we can work together to plan our work, to communicate, and to build similar processes. The Food and Feed Testing Laboratory Best Practices Manual. So much of what we do in the regulatory work depends on the integrity and the timeliness of laboratory analyses that we can rely on. This product came from our laboratory work group, which did a gap assessment, realizing where are the areas we need to improve in, and how can we, as a federal, state, and local work group representing laboratories, address these gaps. And so this document now has best practices for methods, for sample handling, processing, for communications, for worksheets, for proficiency testing. So that has caused quality improvement in the laboratory realm. Our business process evaluation and improvement tool for inspection systems. Again, we have a lot of inspections, a lot of inspectors doing a lot of work in different focus areas. So identifying 9 core areas where we have a common focus, that we can have common language and common systems was critically important. Our common data elements, we have 3,000 local health departments, 50 states, and a handful of federal regulatory agencies, and there's probably almost that many information systems. Wouldn't it be great if we had either a common information system or information systems that spoke to each other effectively? The goal of this project was to start building the terminology, the groundwork, so that we can realize that goal in the near future. And the Animal Feed Network, which is a web-based information sharing site for regulators looking both at pet food and health issues along with livestock feed and health issues. Again, the members of this work group, like all of the work group, really represent the integration that we're looking for with federal, state, and local officials from across the country. And from a human health perspective, this is critically important because this is the first time we've had something like this where we can gather and share information on what's happening in our animal populations, which of course also has a correlation and an impact on human health in our communities. Now you may be asking, where can I find all of these documents and where can I find more information about the PFP? I would strongly encourage you to go to the website, fda.gov/PFP. There you'll find links to all of the documents that we have discussed this morning, along with many more. There's also links to our PFP newsletters. Every year we have 3 newsletters which communicate what we're doing and where we're going from here. So here are the logos for our last 4 50-state meetings, which is really where the magic happens, where we bring together regulators from across the country, 200 or more at each of these, and focus on what are our opportunities, what are our strengths, weaknesses, opportunities, and threats, and how can we move forward. Here are a few images from the last 50-state meeting. The picture down at the bottom right, I think, is a good picture representing what really happens there, and it's an intensive 2.5 days of really dissecting all that we do and looking for opportunities that we can move forward on I know at the end of those 2.5 days, I think everyone is completely exhausted, and we've done all of the strategic planning and in process analyses that we can possibly manage. The purposes of that 50-state meeting this past year was primarily strategic planning. Okay, the PFB had drafted a strategic plan, but before releasing it, we felt that it was critically important to share that with all of our partners, pull it apart, dissect it, put it back together, and then do it all over again. And that's what happened. Participants and breakout sessions did just that. It was a very participative process, and in the end, I think we have a product that is really indicative of where we're going with integration, and that gives our work groups very measurable, objective tasks for moving forward. And so with that, I'm going to hand it over to Pat Kenley, who's going to talk about that strategic plan and how we're going to make those things happen.
Thank you, Adam. Well, I've got the best slot of the day. I'm the only thing standing between you and lunch, so we'll try and plow through here and cover the high points. The strategic plan is something that the Governing Council, and I co-chair the Governing Council along with Barbara Cassens from FDA. I would like to say that I've certainly noted a very strong commitment on the part of FDA to really move integration forward and to really get behind and stand behind all of the necessary work that needs to be done to really make some measurable improvement in this. I've been, in the regulatory capacity for almost 25 years now, and as I look back over the years and attending AFTO conferences and other events, interacting with FDA, out in industry as a field inspector many years ago and as a supervisor and as a manager over the last 10 or 12 years, I've seen a major dramatic shift in the direction that FDA is going and the way that they are dealing with issues. And, it really is becoming much more of an integrated process. And the commitment that FDA has demonstrated, I think, especially through just looking at the members of the Government Council that you saw on the screen a little while ago, these are deputy-level staff members. FDA is really committing, high-level personnel that can make, these things that we identify in the PFP work groups happen. They're committed to it, and, we're all moving these issues forward as expeditiously as possible because we all recognize the benefit of moving towards a nationally integrated food safety system. So with our strategic plan, we've been working on these projects, as you've heard, for quite some time, but the Governing Council really took a step back and really looked at FSMA and picked about some of the key elements of FSMA and really tried to identify some of the things that we believe needed to be put in place over the next few years to really make some measurable, marked improvement in how we're integrating and the work that we do on a daily basis. So the Governing Council spent quite a bit of time late last year coming up and identifying some of the core elements that we believe needed to continue to be worked on. And we put this draft together, and as Adam talked about, a group of state, local, federal officials came together and really took that draft plan and broke it all down, looked at the elements, kicked the tires, and built it back up and affirmed all that information in there. So what we have in this strategic plan is a 6-year strategic plan, because a lot of these things that we're going to be working on are building blocks. They're things that we need to do to continue to build on top of each other to make some measured improvement and some marked improvement as we move forward. The vision in this plan is mutual reliance for a safer food supply through collaboration, sharing solutions, and solving problems. And that's really what it's about. It's about doing it together and finding the most efficient and effective way to achieve our end goal, which is, again, the safest food supply that we can have. So the primary goal areas, there's 7 primary goal areas in the plan. Everything from outreach and how we communicate with our partners and with the public and industry, to dealing with some of the very core fundamental issues of how we do our jobs on a daily basis as regulatory programs. How do we work plan? I could probably ask the question here, but I already know the answer. How many of you have experienced, if you're in the processing industry, an inspection by your state program and a federal program, fairly close to each other? That's because for years the programs didn't talk. They didn't communicate on where they were going or what they were doing. Joe's example this morning of the toothbrush versus sharing data, sadly to say, is the way that people have felt for many years. They cherish their data, they cherish their information, and they didn't necessarily see the value in working and coordinating together. We've done work planning in our program with FDA, and the benefits of that are tremendous because you actually can make some measured improvement together, much more than you can individually. Compliance and enforcement issues. We're going to be addressing some of those. We heard from Travis this morning on surveillance and response, post-response and foodborne illness outbreaks, food contamination events, whether they be intentional or unintentional. Huge area, and something that FDA and the states have invested a vast amount of resources in improving over the last few years. Laboratory sciences, again, a key cornerstone of regulatory programs is the ability for our labs to identify potential contaminants in foods and how that information is communicated and shared amongst partner agencies. Informs a lot of the decision making that we do. Training and certification, again, another cornerstone foundation. We have to have a well-trained workforce. And FDA's personnel, the state personnel, local personnel that are doing the same types of facility inspections should be receiving the same types of training, and they should be standardized to ensure that they're all covering the same types of issues. If we're all enforcing the same rules and we're all using the same scientific principles when we evaluate operations, there should be that same level of consistency provided to the training and certification that we do for our staff across the board. And of course, information technology, which is another key piece in making sure that we can actually share the data once we have it. So right now where we're at, we finalized the strategic plan in late November of last year after we got feedback from state, local, and federal agencies. We've rolled that out. In December, we had a meeting with our work groups. Each of those elements that we just talked about have individual work groups that are associated with them. And so as of December 10th, those have kicked off and actively gotten started. So they are working on their projects. So some of these work groups have carried on. As you can see, we've had some that have been in existence. We actually have resurrected two of them. Both the work planning work group and the laboratory science work group previously existed. During the last 2-year cycle, they didn't have any projects that they were actively working on, but we have resurrected them and brought them back because, again, they're very core elements that look at how the work we do is going to be able to be integrated and handled on an ongoing basis. So our work groups are made up of both FDA and either state or local co-chairs. So we've got active participation from a variety of levels of government leading these work groups. This is an all-volunteer force. We all have full-time day jobs, sometimes, more hours put in than the 40 a week to manage and oversee what we do on an ongoing basis. But these folks are very committed. They all have bought into the process and understand the critical importance of making sure that we make some measured, marked improvement in how we integrate and we work together for the betterment of the food supply. The Governing Council, each of the Governing Council representatives participate in these work groups as well, so that there's that connection between the Governing Council and the work group chairs and the work groups themselves. And as was mentioned this morning, we've actually provided project managers for each of these work groups to help make sure that the projects stay on track, that they're coordinated, they get a little bit of help with the administration and scheduling of meetings and calls and so forth. So a lot of effort there, and we appreciate all of the support from the staff that have volunteered here. So I just want to touch base very briefly on some of the projects that they're going to be working on under these. Outreach is a new work group that we've actually initiated in this last cycle. One of the things that we found is, we can do a really good job of working together and coming up with projects and best practices, but getting that information out to the people that need it, the local and state regulators, informing them of the importance of it and informing the decision making that they do to help them understand why they want to pick this best practice piece of paper up and actually work with it and utilize it. So our outreach group is going to be really focusing on making sure that we can communicate effectively, that they can get this information and get it disseminated. They're evaluating our methods that we're using currently. Simply posting it on a website and sending out an email once in a while is not necessarily going to do the job to really enforce and reinforce the importance of some of these materials that we're developing and how that's going to help their programs do a better job at protecting their customers within their jurisdictions. Work planning and inspections, again, another major cornerstone.
Our goal here is going to be to implement coordinated approaches in planning and the conducting of industry oversight activities. That includes everything from work planning, all the inspection work we do, to conducting inspections, sampling operations that we may engage in any given year for high-risk commodities or suspected contaminated food items. How do we work together? How do we ensure that we don't duplicate efforts? How do we make sure that we share that information back and forth? If we have information about, a company that's, they've changed locations or they've gone out of business, do we share that with our federal partners who also regulate that particular entity so that they don't waste time and resources going out to a facility that hasn't been there for 6 months or longer? The group is going to look at strategies for providing input into FDA's work planning process. FDA develops their work plans in the centers. They have a lot of data from their own inspections, but as we heard mentioned earlier, the states right now are doing about 80% of the inspections in this country. And that information is not all flowing up to FDA. And we want to make sure that we can get that information up to FDA, and that can be used as part of the risk assessment and the evaluation process to determine what are the priorities for the next year? How do we want to focus our inspectional resources so that we deal with the highest risk issues and not so much the lowest risk issues? We want to make sure that we're not just going and hitting a facility simply because it's come up on their time on the calendar for us to come back and inspect them, but that we're actually putting some significant thought into the real risks associated with the operations and how we're going to then appropriately prioritize all the limited resources that we have to best cover those. We're going to also be looking at developing some model inspection protocols and joint inspection protocols, again, putting those out as best practices. We're going to have subject matter experts providing input on the inspection strategies as we have these new preventative controls and produce safety rules that are going to be finalized and published later this year. Those are going to be implemented over the next several years, and there's going to be a huge effort to work with industry and provide education, and work with them as they start developing, their efforts to comply with these, making sure that we have strategies for how we're going to approach those that are equivalent across the board is going to be very important. So there's going to be active work in that area as well. Compliance and enforcement. I think everyone looks at compliance and enforcement as that big hammer that we can bring down to make sure that change is effectuated and that we have compliance with the rules. But I think Mike Taylor said it best this morning, we have to educate before we regulate. The most effective tool, and anybody that's been doing a job as a regulator for any period of time, they're going to tell you the most effective tool is explaining to somebody, explaining to an operator the reason behind why you're asking to do something. We're not just asking you to do something because it says so in 21 CFR Part 110. We're saying that it needs to be done because there's a risk associated with that production activity, and you have a means of controlling that risk. If you understand the hazard, you understand how to control the hazard, we can work with them and help them understand that process. So this group is going to be taking a look at how we put that into a best practice. How do we work with that so that we don't go out and have staff that look at their regulatory authority as the only means of gaining compliance, because we want them to use that educational opportunity first. This group's also going to be taking a look at best practices of coordinating compliance strategies and coordinating enforcement activities. Agencies have different authorities, and sometimes there's a better fix. When we have an operation that has been identified as being associated with a foodborne illness outbreak and they've got contaminated foods, they're refusing to recall their product because they don't want to have the cost of the destruction. They may not buy into the process that their product has been associated with an outbreak. There are a variety of tools we can use to ensure the public protection, but some work better than others for that type of an imminent situation where we need to make sure that product is removed from the marketplace. So we want to make sure there's strategies when we have those rare situations occur, rare but critical, because when we've already got cases of illness and death, we can't allow product to continue to stay out there any longer than we absolutely have to. We have to work effectively together to get it out of the marketplace. So we need to make sure we have those strategies in place when we have those events that occur. Also look at establishing mechanisms to accept compliance data from other strategic partners. Again, state and localities doing a large number of inspections. How do we feed that information back to FDA? How does FDA feed their inspectional findings to state regulatory programs so that we can all coordinate and decide how best to deal with noncompliance issues together? Travis touched on this morning, so I'm not going to go into great detail. This is the surveillance response and post-response work group. This is actually one of probably our most active work groups. I think we've got well in excess of 55 members on this group. Response to foodborne illness outbreaks and recalls has just grown, as a major important issue over the last decade. As we've seen, increased numbers of food contamination events and foodborne illness outbreaks, the profile of those, the attention that they're garnering in the media, has certainly grown. We've had recalls. Some of the largest recalls we've seen in the last 10 years, have come about, and it's ultimately it falls on the response to the regulators to deal with all these things. We need to have very concise and controlled strategies as to how we're going to do that. So this group's going to work on those. Travis covered a lot of those topics that they're working on this morning, so I won't cover those again. Laboratory sciences. Again, this is a cornerstone program for regulatory agencies. Their goal is going to be to promote consistency and facilitate information sharing through establishing and utilizing national laboratory best practices. This group did a wonderful job of coming together and establishing best practices. Adam talked a little bit about that. It's been a couple of years. They're going to come back and take a look at that again. They're going to look at how they can set up an ongoing process to continually update that, because lab methods are changing, processes are changing. We want to make sure that that stays as current as can be. How do we share that data amongst each other? If a state lab is testing products and identifies a microbial contaminant, how do we make sure that that gets to the other FDA districts or the offices or the other states where that product may have been produced, to ensure that they have then the knowledge and the ability to take the action necessary to protect the public, trace that product forward to figure out where else it might have gone, and ensure that they work with the company to get that product removed from the marketplace and prevent any other illnesses and deaths from occurring. So a lot of work in that area. They're going to increase the sharing and use of lab data. Again, identifying gaps right now that we have and how we can close those gaps to better inform decision making on an ongoing basis. And I think one of the most important pieces, again, I'll come back to, is that training and certification of staff. This work group's been involved in a lot of activities for a number of years, and I think it still serves as one of the most important pieces of our puzzle as we move integration forward, and that's making sure that we have a very qualified and well-trained workforce. This group is going to provide input into the development of standards and certification programs that will promote consistency amongst all of our programs. They're going to be looking, and they're subject matter experts, are going to be looking at core competencies of the jobs, doing job task analysis, and then identifying what trainings are out there that we can pair up to make sure that those job task analysis and those core competencies are linked and that the staff get the training they need. And where there's gaps identified, work with FDA to hopefully develop some additional training or identify other training resources, whether it be through academia or IFPTI or other great venues for making sure that we have a well-trained workforce. They're going to work on a lot of that. They're also going to be participating in the 2015 training summit that FDA is going to be holding later this year, again, to really focus on where we need to develop training. We have a large number of new rules that are going to be coming out over the next couple of years, and if you consider, how many folks we need to train, it's not about just training the regulatory workforce, but we also have to look at training for industry and preventative controls, produce safety rules, safe transportation. It's an ongoing list, and the vast number of people that have to be trained in a short period of time can very well be overtaxing. So they're already starting to tackle some of these issues and look at how that can be best implemented to make sure that all of our staff have that same level of training. And of course, information technology, looking at data and how we share data. While we could still shuffle paper and get the carbon paper out to make copies like we used to back in the 50s, it doesn't work anymore. We can't do that efficiently. We have to have data systems, and data systems as we move forward really need to be able to speak with each other to share some of those common data elements that we all need so that we have the best information and the most current information available to inform all of our decision making. So this group's going to continue to work on that and expand on the work that they've already done with the data elements. We're looking at data exchange capabilities right now to be able to share inspectional data amongst partner agencies electronically. They're also going to be looking at existing FDA systems where states enter their inspectional data into FDA, and potentially new systems that are looking at being developed that will hopefully be more advanced and have additional capabilities to allow for additional sharing. So again, corner piece here. This group also embeds their members in some of the other groups as they have IT projects to make sure that we have some consistency and cross-communication of the programs. And to the extent possible, we take these groups, there's a lot of initiatives going on within FDA directly and within some other associations. We will have these groups try to participate in those processes as well so that we make sure that there's that full integration and collaboration on issues. There's a lot of development going on within FDA in the process of getting ready for the preventative controls and produce safety rules, how they're going to be rolled out, how they're going to be implemented. You know, our work groups where there's crossover have been participating in those discussions and those activities, not only to get that information from them, but to inform them to keep in mind some of these integration aspects that we've been trying to work on for so many years. So this structure, as they develop their protocols and they develop their projects and their best practices, they're going to float back up to the Governing Council. The Governing Council is going to review them, vet them, make sure that they've had other scientific and technical review where necessary. But in most cases, the work groups are very good at bringing in the folks they need to make sure that they get that expertise in at the ground level. Once that's done, then it's going to be hopefully disseminated through our outreach group. We'll make sure we get it out to our partners and that all that information can be widely disseminated and shared. So I think just to end up here, the takeaway message, more than anything else, is just to remember that this is a multi-agency project. It's federal, state, and locals working together to better enhance our ability to protect the food supply, because the best way we're going to do it is by working together. We're much stronger working together than we are individually, and we're going to be much more effective at ensuring the protection of public health if we continue to strategize together. We're not a policy-setting group. We're a bunch of volunteers that work in a variety of levels of government that come together because we believe in the necessity of moving this initiative forward and the benefits that we're going to realize from it. So we're going to continue to work hard in these areas and continue to move forward, and hopefully you will see the benefits of that over time. If you have any specific questions about PFP, feel free to send an email to either of our two project managers that are involved in the project. I'd be happy to connect you with the resources or the individual work groups if you have questions to get you any of the answers that you need. With that, I'm going to turn it back over to Joe. Thanks.
Thank you, panelists. Are there any questions before we break here for lunch? I did want to say that I know we've thrown an awful lot at you today or this morning. And I hope we've convinced you that there really are a lot of great things going on within the regulatory community to hopefully help us improve on our job performance and service public health. This afternoon, however, we're going to listen to those groups that I told you that we didn't engage very well with the last time we tried to do this back in the late 90s, and that is the consumer groups and the industry folks. And they're going to be here to offer their concerns, their praises, or their criticisms. And we, I guarantee you, will be listening very, very closely to what they have to say. And after that, we will conclude with our final panel, which hopefully will take this entire vision of an integrated food safety system and inform you how they envision we will then employ it in a great amount of work that we will need to do to implement the Food Safety Modernization Act. So thank you for your participation this morning, your listening this morning, and we will reconvene at 1:30 p.m. Thank you. Great job, guys.